Hi, I'm Jamie Banner and I'm the founder of Medicare by Jamie. I'm a licensed insurance agent that works specifically with people enrolling into Medicare. And today I'm going to go over the Medicare costs for 2022. So every year around the end of the year, usually in November, the Center for Medicare and Medicaid Services announces the new cost of Medicare numbers for the following year. And this year is no different. But the slight difference this year is how different the cost numbers are based on what the projections were. So although the projections were things increasing by just a few dollars, we're actually seeing a pretty substantial hike in a lot of things like that Part B premium that you need to be aware of going into this new year. So I'm going to dive right in and talk about all of the costs of Medicare numbers. Now, when we look at original Medicare, we've got two different parts. We have Medicare Part A and Medicare Part B. Medicare Part A is your hospital coverage and Medicare Part B is your outpatient coverage. And these coverages are separate in terms of their monthly premiums, their deductibles, and their cost share for you. So we'll break it down directly into the numbers. When it comes to Medicare Part A, which is your hospital coverage, most people don't pay a premium, and that doesn't make it free. It's because you've been paying pretty much your entire working life. So when you look at your paycheck every 2 weeks, that little section says Medicare, that's going towards your Medicare Part A premium. So if you've worked a minimum of 40 quarters, which is going to be 10 years, you're going to pay $0 for your Medicare Part A once you enroll in Medicare because you've essentially paid it off. Now, if you worked less than 40 quarters, you're going to actually pay for that Part A premium, and what you pay for that is actually dependent on how many quarters you work. So, if you worked between 30 and 39 quarters, you're going to pay $274 a month for your Medicare Part A. It's a pretty big jump from $0, especially if you're at that 39 quarter mark and you're missing just a single quarter. But for 30 to 39 quarters, your Medicare Part A will be $274 per month. And if you work fewer than 30 quarters, so somewhere between pretty much 0 and 29, and you're not qualifying off of a spouse, you're going to pay $499 per month for your Medicare Part A premium. So again, pretty substantial difference between $0 versus $499. But again, it's all based on the quarters you worked during your working lifetime. Most people have worked the 40 quarters, so you're going to have a premium-free Medicare Part A. But there are some other costs with Part A that you want to be aware of, and one is that Part A deductible. The Part A deductible is kind of different from all the deductibles that you might be used to on your working plans, because typically those are annual deductibles, so they run from January to December. The Part A deductible is a per benefit period deductible, which means that you may actually pay it more than once a year if you don't have something like a Medicare supplement plan that covers it for you. And that's what I do. I help people enroll in Medicare supplement plans. If you have any questions, you can always give me a call. It's 833-65-JAMIE, and I'll walk you through how your plan will cover that Part A deductible, as well as a lot of the other costs associated with Medicare. But say you don't have a plan and you might end up paying that Part A deductible. In 2022, that deductible is going up to $1,556 per benefit period, so $1,556. Essentially what that means is if you are hospitalized on day one, bam, you are hit with the Part A deductible. And then say you're released 3 days later. If you go more than 60 days in between those hospitalizations and then you're hospitalized again, you could pay that $1,556 again. If you're hospitalized within those 60 days, it's going to cover that. But past that 60 days, you'll pay that again. So you could realistically pay that multiple times a year if you're having a pretty terrible year. So you really want to be aware of that Part A deductible, because although the premium is most of the time $0, the deductible is in play for everyone, and you want to make sure you have some type of plan that's going to help you cover that. Now that deductible is going to take care of hospitalization days 1 through 60. But if you're hospitalized more than 60 days, there's going to be some other costs associated with Medicare Part A. So for days 61 through 90, you're going to be paying a daily coinsurance of $389. So that's once you've got past the deductible and now you're hospitalized days 61 through 90. If you had a horrible illness and you're hospitalized even further past 90 days, now your coinsurance is going to be $778 from day 90 on until you've pretty much exhausted your lifetime reserve days. Is it likely you'll be hospitalized for more than 90 days? I really hope not, but if you are, these are your coinsurance amounts that you want to be aware of. They increase unless you, again, have something like a plan that picks them up. You're going to be paying a daily coinsurance every day until you've exhausted your lifetime reserve days, and then you're responsible for pretty much all of the costs under Medicare Part A. So something to really be aware of. So those are the big costs I'm talking about with Medicare Part A, and now we can move on to Medicare Part B. So Medicare Part B is your outpatient insurance, and most people are aware that everybody pays a premium for Medicare Part B. Whether you have a just original Medicare, you have a Medicare Advantage plan, or a Medicare Supplement plan, everyone pays a premium for Medicare Part B. And most people pay what's called the standard premium. So the standard premium for Medicare Part B in 2021 is $148.50. And in 2022, it is going up to $170.10. So that's a pretty significant increase from $148 to $170. It's higher than what was projected, and it's apparently related to the approval of a recent Alzheimer's drug, as well as kind of the curbing of the cost from previous years is now kind of catching up with us at 2022's premium. So if you are making the standard income, which I will talk about how income may affect this later, your Medicare Part B premium in 2022 will be increased to $170.10. And like Medicare Part A, Medicare Part B also has a deductible, but luckily this one is annual. So it's not that per benefit period where it hits you multiple times a year. This Medicare Part B deductible hits you once per year, and it's from January to December. So once you pay that off, it doesn't reset until the next year. In 2021, the Part B premium is $203, and it's going up $30 in 2022, so it's going to be $233. So not huge. A $233 deductible for the year is pretty doable. It's definitely a lot less than what my annual deductible is. But again, it is a deductible that will be annual, so just January to December. So realistically, you'll pay that off with one, maybe two doctor's visits. So not anything too alarming, but it is going up in 2022. Now, what I had mentioned before is the $170.10 Medicare Part B premium is a standard premium. So the way Medicare and Social Security set these premiums up is based on your modified adjusted gross income, known as your MAGI. So if your MAGI is higher than a lot of people's around the country, you are going to actually pay more for your Medicare Part B premium than someone else would. So the income levels are based on the way you file your taxes. So whether you file single or married filing together or married filing separately, you can have an increase on both your Medicare Part B premium and your Medicare Part D premium. And I'm going to get into those numbers right now. So the level for the Medicare Part B premium alone to stay at the standard amount, you must make less than $91,000 individually, so filing single, or if you file married jointly, you must make less than $182,000. If you file single $91,000 or less, or married $182,000 or less, your monthly premium for Medicare Part B is $170.10. So you're not going to get what's known as an IRMAA, which is an income-related monthly adjustment amount. But if you make more than that, then your Part B premium and Part D premiums will go up. And mind you, this is not just based on your salary, it's based on your modified adjusted gross income. So a lot of things can factor that, like inheritances, estate sales, and your income, as well as retirement benefits, pension, things like that. So there's a lot of things. You have to look at your entire income. Essentially what they're going to do is they're going to pull your most recently available tax return. So typically that's about 2 years ago. So for 2022, we're thinking something like your 2020 tax return is what they're going to look at to see what your Part B premium should be. Now, mind you, if things have substantially changed, so you stopped working at that point and your income is significantly less, you can always appeal that, but you have to set up the appeal with Social Security because they're going to go just based on the information that they have. So let's look at the levels and how much things increase. So the next level up, if you're filing single between $91,000 and $114,000, or married jointly between $182,000 and $228,000, you're going to have an increase on your Part B of $68, which is going to make it $238.10 a month. So boom, right away, the first level up is an increase of $68 a month, which is going to put your premium $238.10. And also your Medicare Part D premium will have an added amount of $12.40. So the Part D is a little bit trickier because the monthly premium on the plan is based on what plan you choose. But just know if you're in this level, you will also have to tack an additional $12.40 on as your IRMAA charge. Now the next level, single, if you're filing between $114,000 and $142,000, or married jointly between $228,000 and $284,000, your monthly premium is going to be increased by $170.10. So essentially we are doubling the Part B premium, which brings your total to $340.20 per month for Part B. And your Part D add-on is going to be $32.10. I'm going to kind of run through these a little bit quickly. The next level is $142,000 to $170,000 single, or $284,000 to $340,000 married jointly. And that's going to increase your premium by $272.20, which makes your Part B premium $442.30. And your Part D add-on is going to be $51.70. The next level, single, $170,000 to about under $500,000, and married jointly is $340,000 to right under $700,000. Your Part B premium will be increased by $374.20, which makes the total $544.30 per month. And your Part D add-on is $71.30. So we're looking at some pretty steep hikes. So obviously the more you made, the higher and higher it gets. And then the highest level. So if you were single, $500,000 or more, or married filing jointly, $750,000 or more, your Part B monthly premium add-on is going to be $408.20, which makes your total premium $578.30. And your Part D add-on is going to be $77.90. So again, that's on top of your Part D premium. So there's some pretty steep hikes. Like I said, the more you make, the higher it goes. There are ways to appeal it if your income has changed. But like I said, if you had even these major deposits like an inheritance or estate sale, it's a little bit harder to appeal those because you did get that income. Really the biggest one is a change of life event. So if you stopped working, if you had a divorce, something like that is usually more likely to be able to appeal it. But if you have any questions, you can always give me a call, 833-65-JAMIE. I'd be happy to help walk you through that. It's part of my overall service. We will help set you up with a Medicare supplement, Medicare Part D, walk you through the IRMAA steps, and just applying for Medicare in general. So again, these numbers are the cost of Medicare numbers for 2022. Some of the hikes are higher than what was predicted, but we're going into New Year kind of making up, unfortunately, for the fact that last year's hike wasn't as big as it probably should have been. So it's definitely not the news we want to hear. Luckily, there was a large cost of living adjustment this year with Social Security. It went up 5.9%, so it's one of the bigger hikes they've had. And this increase should not eat that whole cost of living adjustment, but obviously we don't want to have to devote that to these new higher premiums. It's kind of like they give us more and then they take some of it away, so why even give us more? It's kind of a catch-22. But with that, we can go into Medicare making sure we budget the right amount and set ourselves up to make sure we are getting the best deal, especially on things like our Medicare supplement plans. It's something we should definitely be continuously shopping rates, making sure we have the best plan, and making sure that we are getting the most bang for our buck, because these plans are standardized. So your plan G, if you're going up in cost, there's another company with another plan G that's definitely going to be at a lower rate. So like I said, if you have any questions, you can always visit my website, www.medicarebyjamie.com. You can also give me a phone call, 833-65-JAMIE, or send me an email, jamie@medicarebyjamie.com. I'd be happy to do a cost analysis for you. Or if you're new coming into Medicare, I've got a ton of resources to help you out to make sure you start out on the right foot and get everything done exactly the way you need to. I know Medicare can be a little bit tricky, especially if you haven't done any of this before, but that's why I'm here to help. So thank you so much for watching. If you found this video helpful, please give it a thumbs up and subscribe and leave a comment down below. Have a fantastic day.